At RMHF, we view ourselves as catalysts and conveners. The Co-Learning and Equity Initiative is one example of where we've connected disparate organizations and individuals and provided them with skills to advance health equity in the Richmond Metro Region.
We had 8 grantee teams. Each of our teams had multiple organizations and at least one community member represented as an integral part of the project team.
Collaboration allowed a lot of individual and collective voices to emerge in a way that was far more genuine than I think would have occurred if we'd been working on the project in isolation.
Community advocates were present in the meetings and were involved in our work. They made us really stop and think by offering perspectives that we never even thought of.
Community members also brought a real joy about the project. For them, this project really represented hope. I think when they were able to join us on this team and be able to influence a way of proceeding that they had never been able to do before. They typically had been recipients of the service, and now they were the designers of the service.
The community, we were there all those years when we were under-resourced. Now things are beginning to move forward. We now had this amazing project that was funded.
As a youth who is a part of this project, my voice felt not just important but necessary for this process.
Hearing those voices and having those voices play a significant role, I think enhanced what the professionals brought to the project.
We hold space for others who are experts in their own fields and provide an opportunity for them to learn how best to apply a racial equity lens to their own work.
Applying a racial equity lens to our work was really eye-opening. What we discovered is there were language barriers, there were transportation barriers, there was a lack of trust. There's just so much more.
Having some structure around shared learning and using tools like racial equity tools, or really thinking about the structure of the coalition, helped to sort of put guardrails up so that we were always moving deeper into the issues we were looking at, and it still gave a framework so that we could be surprised by what we were learning.
I think the biggest lesson that I have taken away from this process is just the importance of having community members at the table. It was just incredibly powerful to have them there and really solidified for me that this should be the standard and not the exception.
It's very important to understand when you're doing community work, you have to be responsive to the rhythm of the neighborhood. So I would say the process taught us to relax, be patient, trust people that have lived in the neighborhood, and kind of figure out how we can find common ground.
Other organizations, though they may be doing different work, may be experiencing the same challenges that we experience, and we have an opportunity to learn from one another.
The truth is, there's other service providers and organizations and people who can help move towards a solution, and we should partner with them.